Hi everyone, I'm finally back. I apologize for not having released a video since January now. I intended to do so much more regular basis, but I went through kind of a tough time this year. Actually, I've gone through a tough time since the brain surgery, but there definitely became a period of time, which was probably fairly evident with my last video, where I went into a pretty bad depression over it all. It was a combination of the medications the doctors were putting me on, caused me a lot of problems there for a while. There were a lot of these neurotransmitter type medications to try to alleviate the pain, and it really caused me a lot of problems as far as my emotional state, mental state, everything. I finally did get off of those, and now I'm on a medication called naproxen, which is for an anti-inflammatory. It's a controlled release drug. I take it once per day, and it controls the inflammation all day. And I also take Percocet. The Percocet originally did not really do much at all. Now it's getting where it's at least somewhat helpful sometimes with the pain. I don't take it very often, but I rely on the naproxen. Without the naproxen, I would basically be completely disabled. They still have not come up with an answer as to exactly what is causing the pain. It's something to do with the occipital nerve. They definitely know that because it travels from the surgical site down my neck a little bit and then up and over on my head. I've been searching for so many doctors, so many different things. I've got an appointment with yet another neurologist because I really wasn't real happy with the neurologist I'd seen earlier this year. And that one's coming up at the end of August, to try to give me an answer of why. When I talked to the surgeon at Johns Hopkins, he basically, said, really sorry for your pain. It doesn't really happen normally. This is not a normal thing for people to go through. The inflammation is normal, is what he tells me. What they do is they actually cut through all of your neck muscle on that side. Then they burn through it, basically. So when they sew it back together, it's pretty obvious that you're going to be hurting. And he says the inflammation, it's actually fairly normal for the inflammation to still be present after a year. He said the pain is not normal. When I talked to the pain management doctor said that doesn't make a whole lot of sense because inflammation would be an indicator that there should be pain. I don't know. I'm not a doctor. I don't claim to be a doctor. For me, it basically, the inflammation has gotten better, even without the naproxen. I don't have the bulge that I had before where everything gets swollen in the back of my neck. But after the naproxen wears off, the pain is mind-blowing. It starts off with almost like a cramp sensation that starts spreading, and at that point, it's like somebody has really just taken something in the back of my neck and is just turning it, pulling the entire nerve ending. Basically, it's like a shooting, debilitating pain where any movement of my neck whatsoever just is. It literally made me in so much pain a couple times where I was hoping I'd black out because I couldn't take it. And there have been some unfortunate events where even on the naproxen and with the Oxycontin and with everything, it won't stop. It can go on for hours and hours. Thankfully, normally it's not the extremely intense pain, but it's pretty intense even then. And there's nothing I could do. Thankfully, the pain management doctor has been working really hard with a different series of injections. Well, not different series, it's all been the corticosteroid injections, I believe is how it's pronounced. He's put that in there. He tried an occipital nerve block. What he did find out is I've got a severe inflammation in my AA joint. And because of that, he thinks that it's like swelling up, putting pressure on the occipital nerve, and that's what's causing my headaches and my neck aches, whatever aches, my wanting to die pain, basically. In any case, he'd gone through a series of injections. I've lost count now, I think 5 total over the course of the past 6 months. Most of them not effective. I had one that was effective for about 5 days, and then it went right back to where I had to have that naproxen or I could not function. It had gotten worse though. Last one until this past week had been almost 3 months. And then it started getting worse and worse and worse, where I would constantly feel this sensation like I was going to have a problem. Even in the middle of the day, didn't matter when I took a nap, I was taking higher doses than I really should have been, trying to alleviate. So I finally decided I got to go back and get another injection, see if that helps. Thankfully it did. He injected me, I swear, I think he stuck me with like 15 needles this time, of different for numbing agents and for the steroid injection, and he probed all over trying to make sure he got it covered. My neck was extremely swollen in the back for about 20 or 30 minutes after the injections, and I could barely move my neck. It hurt so bad. And then the worst part is that after you get these steroid injections, you are completely wired for a while, which is why I'm up at almost 3 o'clock in the morning, not quite 3 o'clock in the morning again. I barely slept between Thursday and Friday night. Ended up going into work very early in the morning and using all my energy to do some things around the office there, because there was no way, it was impossible for me to sleep. I ended up coming back home by early afternoon thinking I'm exhausted, I'm going to try to sleep. It didn't happen. There was no way. My heart was just racing because of these steroids. They apparently, it doesn't actually go into your bloodstream, but it leaks into your bloodstream a little bit. Anyway, so far it's been completely worth it, because I think he really got it this time. At least I'm hoping. I'm really hoping that maybe this is going to last a little longer. It had gotten a much quicker reaction this time. Normally he says about 5 days for you to expect to see results, and this time it was, I could tell Thursday night, because normally when that naproxen is 24 hours, is however you're supposed to take it, by around the 22nd hour or so, somewhere in that time range, depending on other things, I can feel it and it's time to take another one. Right at that 24-hour mark, if I miss it, I could very easily go into a pain attack. This time, for the first time in I don't know how long, I forgot to take my medicine for a few hours, and I'm like, okay, feels better. So, in any case, that's where things are at with the pain. At this point, the injection hopefully will work for a while. If not, I guess I'll have to go get another one. The naproxen is key. That anybody going through this, you got to talk to your doctor about naproxen. It's a time-release naproxen sodium. It's much safer than ibuprofen. I found ibuprofen is not a good thing to be taking every day, and it definitely helps with that part of the pain. I didn't find any opioid-based medicine. They tried me on everything from hydrocodone, Oxycontin, Percocet, and a morphine, short duration morphine, and none of them really worked for the pain. The only reason I say that the Percocet works a little now is for the tightness that occurs. It can offset it. The naproxen is the key ingredient in the mix, but if I've taken my naproxen and I need a little something just to kind of help with it, it does help a little. So, but yeah, the naproxen's key. Definitely a must-have for anybody going through any sort of inflammation problem of that nature. As you can tell, my face is better. It's not really where I would like to have it, but it'll never be. I'm pretty confident in that. It's going to keep getting a little bit better, a little bit better, a little bit better. I just had to accept the fact I'm not going to be the same as I used to be. There's nothing I can do about that. I keep going. There for a while, I definitely went through a really rough time. It wasn't until April that I finally was able to remove the eye patch. I can blink the eye, fairly well now. It still gets dried out. I still have to put stuff in there because the nerve that controls the tear ducts in the eye still doesn't work. So I still have to put stuff in there, but not as often, and it doesn't really bother me nearly as much now. So I'm thankful of that. It was a great thing to actually be able to have depth perception again. It definitely had gotten to a point, which, like I said, I actually just was considering whether I should delete the last video that I put up on YouTube or not, because that was really me hitting close to bottom there. But I figured, it's part of the process. It's part of what happened to me. The thing I regret is that it's taking me this long to come back and let everybody know, hey, I made it through it. I'm okay, and I got better. My spirits got better and everything. It definitely got to the point there for a while where, if it wasn't for my wife and son, I would have rather just died than have to deal with all this. But things did improve. So, biggest problems I've had, of course, is that it's not coming back where I'd like it to be. From what I've been able to research online, it doesn't seem like anybody ever really gets the face working normal, per se, again. This is almost as close as it's going to get. I mean, I can kind of smile. It's probably going to get, significantly better, but never going to be quite normal, per se, again. But it's one of those things. I could be a lot worse. There could be a lot more problem than having my face a little screwed up. Thankfully, that my wife has been wonderful throughout the whole thing. I never once had her, treat me as though I'm broken or anything like that, or look at me in a bad way. She's just been an angel. And also, while we're talking about angels, my boss has definitely been quite an angel as well. There's been a lot of situations where you get into something like this, and you worry a lot, because if you're going through this kind of pain, pain that's so bad that if you didn't have medicine, you couldn't function. And even with medication, sometimes it's hard to function. It's obviously a concern, because you're going to have days you miss work. There's nothing you can do about it when you can't even get out of bed, or you get out of bed and you can't lay down, depending on where the neck pain is. And you just can't move. I found sitting up is actually my best possible position when I'm in neck pain, just the right spot. Anyway, I've missed a lot of days this year. There's nothing I could do about it. And my boss has been wonderful, and reassured me she understands the situation, and just get better. And they've even gone so far as to order me in some special ergonomic equipment, and special chair and everything to try to keep me as comfortable as possible through this process. So there's not a lot of people who are lucky enough to be in a job position where not only do you not have to worry over your job, because while you're getting better, losing your job or having problems in that regard, but you actually feel like they're taking care of you. So I'm very lucky, very fortunate in that, and definitely very appreciative of everything. People I've worked with have been great throughout it all. I've got the best possible situation for getting through this in that regard. I've got a lot of people who are supporting me, and I mean, the job I do, I'm able to do without any problem with this. It's just the pain. It really is the biggest thing that is a struggle for me still. I can deal with the facial paralysis. It's coming back. It still sucks. But at least I can finally kiss my wife again, and without it being a really, really awkward kiss. I hope to see the day come where I'm not feeling like I'm a walking time bomb as far as the pain is concerned. When you're stuck with medication, I cannot imagine being able to deal with the pain without the medicine. I've never tried it because it's too much. There's just no way. I've gotten to the point where I probably taken a risky amount of medication trying to get rid of the pain, because it's gotten so bad. I didn't care if I was taking chances on overdosing a little bit at that point. But I try to avoid that as much as possible. Anyway, I know this is not exactly the most well-presented review of my situation as it could be, but I want to let everybody know where things are at. See me better. Not exactly ready for a beauty contest or anything, but I never really was. So, in any case, I wish everybody the best of luck who is going through this, and if nothing else, you can look at this and see that I did get better. And I will try to remember to release another video at some point here, and hopefully there will be even more progress. Hopefully one of these days I'll be able to say, hey, no more pain, I'm good again. But that's pretty much where things are at now. So